Preparing for the NCLEX can feel extremely overwhelming at first, especially when you open your books and realize how much content there is to cover. Many students believe that passing NCLEX means memorizing every disease, every medication, and every lab value, but that is not the truth. The NCLEX is designed to test how you think as a nurse, not how much information you can store in your memory. It focuses on clinical judgment, patient safety, prioritization, and decision making. Once you understand this concept, your entire approach to NCLEX preparation changes and studying becomes more focused and less stressful. The most important step in NCLEX preparation is building a strong foundation in core nursing concepts. You do not need to study from multiple books or switch resources every week. Instead, choose one reliable source and understand the basics thoroughly. Topics like fundamentals of nursing, adult medical surgical nursing, pharmacology basics, and safety and infection control should be very clear in your mind. When your foundation is strong, even difficult NCLEX questions start to make sense because you are able to apply your knowledge rather than guessing randomly. Practice questions play the biggest role in passing the NCLEX. Reading content alone will never be enough. The more questions you practice, the more familiar you become with the NCLEX style of thinking. It is not just getting the answer right or wrong. It is about reading and understanding the rationale behind each option. When you review rationales properly, you start noticing patterns, keywords, and safety principles that appear again and again. Over time, your brain automatically begins to think like the NCLEX expects you to think. Another crucial part of NCLEX preparation is learning test-taking strategies. Many times, students panic when they see a question about a disease they have never heard of. But NCLEX often provides enough clues within the question itself. But focusing on airway breathing and circulation, always focus on A, B, and C. It is very important. Airway breathing and circulation, like these are the basics and the most important parts for all of the NCLEX questions. Patient safety and least invasive interventions, you can often eliminate incorrect options even without knowing the full diagnosis. The exam is not trying to trick you, it is simply checking whether you will choose the safest and most appropriate action for your patient. Creating a realistic and simple study routine is also very important. Studying for long hours without a plan often leads to burnout and confusion. It is much better to study consistently for a few focused hours every day rather than forcing yourself to study all day once in a while. A balanced routine that includes content review, practice questions, and revision of weak areas helps you stay organized and confident. Consistency matters far more than intensity when it comes for NCLEX preparation. Mental health and confidence are often ignored during exam preparation, but they can directly affect your performance. Stress, anxiety, and self-doubt can make even simple questions feel difficult. Taking care of your sleep, nutrition, and emotional well-being is just as important as studying. Avoid comparing your progress with others because everyone has a different journey. Passing the NCLEX does not mean you are the smartest person in the room. It means you are calm, prepared, and able to think clearly under pressure. As the exam date gets closer, it is important to shift your focus from learning new contents to strengthening what you already know. The final day before NCLEX should be used to review weak topics, practice mixed question sets, and revise important concepts. Mainly focus on pharmacology on the last day. Then you will remind everything on your exam day. This is not the time to panic or overload your brain with new information. Trust the effort you have already put in and allow yourself time to rest and reset before the exam day. On the day of the NCLEX, confidence plays a huge role. Take a deep breath before starting the exam and remind yourself that you have prepared for this moment. Read each question carefully, focus on what is being asked, and choose the safest answer. Thousands of nurses pass the NCLEX every year, and there is nothing different about them compared to you. With the right mindset, consistent practice, and smart preparation, and you will pass the NCLEX and move one step closer to your nursing career. So thank you so much for watching my video, and I will see you in the next video.